Here. Leo, welcome to World's Best Physio, where we search to find the best physio in the world to elevate the standards of physiotherapy worldwide and to have a little bit of fun along the way. So, welcome.
Thank you very much. Yes, looking forward to it.
Leo, I'm glad you're looking forward to it. I have two
Yeah.
questions that I have to ask everyone that I interview on World's Best Physio, which I'll kick off with, and then we can just let the conversation go in any direction that we want. I know you've got a special interest in education and
Yep.
in technology, so you're welcome to mention the work experience that you have, the key highlights of your career. One thing that you mentioned before we started recording related to someone who had a stroke, someone that you worked with earlier in your career. And feel free to take the conversation in any
Yep.
direction after these two questions.
Sure.
First question, Leo, are you the world's best physio?
No.
Second question,
Was that quick enough?
that's quick. Yeah, I like it.
Yeah.
Second question, who is the world's best physio?
It is so biased. It's hard to answer this because I do not know every single physiotherapist around the world, and that's a challenge. And I don't necessarily agree that a physiotherapist that broadcasts themselves across the world is the best physiotherapist. So
Mm,
how would I know um, the best physiotherapist? Going through my experience, but this is where I am actually so biased. I have come from Perth. I graduated physiotherapy in Perth, and I worked there for uh, 20 years, somewhere around there.
mm,
And how I see it is that I do have a physiotherapist in mind, and it's it's usually through chatting to many different physiotherapists and speaking to the patients that may
mm,
have gone to these physiotherapists, and also to
mhm,
the
mhm,
students to know,
mm,
um, to listen and get the feedback and say that, hey,
mm,
this is the one that I would consider as the
mm.
best physiotherapist. I won't say the world if that's okay, just the best physiotherapist I know.
Mm, mm,
And in general, I would say that most comments are positive. It's not going to
mhm,
be 100%. The world is not
mm,
does not work in black and white. It's always
mm,
gray.
mm,
And one big thing is that what I realize is either physiotherapists, when they get
mhm,
injured, will go to that physiotherapist,
mm.
or when a physiotherapist has challenges with their patients, they will
Yeah.
refer that patient to that particular person.
So I suppose what you're saying there
That
is that if there's a physiotherapist that amongst physiotherapists is the go-to for a second opinion, or for a physiotherapist's own rehab, that is a vote of confidence in that particular physiotherapist, and
Yep.
therefore says that well perhaps they are higher up the hierarchy of physiotherapists. Is that what you're saying?
Correct, correct.
Yep.
So yes, and I guess I do quantify. Look, I do treat physiotherapists when I was in Perth. So
Mm,
people do trust me to come here, but it's a few rather than
mm,
when I have a discussion with many physiotherapists. If I'm sore, I'm seeing this person,
yep.
and it's there are more people and more consistent, and they get better that way. So
Mm, mm,
and usually to determine the best, I think I still need to know that person, what kind of person, yeah, that physiotherapist is. And I guess I was very lucky. I heard about this physiotherapist and
mm,
I thought that he was the best, and I still do. And
mm,
I actually was his student for his PhD. So I'm very
mm.
biased, claiming the bias,
And you did
but
PhD in lower back pain. You're
in
from
lower back
Perth.
pain.
I'm guessing his initials might be POS.
It might be,
It might
yes.
be. All
So,
right, cool.
yes. So, see, most people do know him, even in
Mm.
Melbourne. So I think
Even in
knowing
Melbourne, we
him.
do know things in Melbourne. That's true.
Yes,
Yeah,
yeah, no, no,
yeah.
no, from
Well,
different
and
states. So,
for those of
yeah,
us, for those listening, because I know that the audience for World's Best Physio, when it's published on YouTube,
yep,
is actually more international than it is
yep,
Australian.
yep,
So you might, dear audience, you might think that well, Perth is an Australian city, and therefore everyone in Australia knows everyone. Perth is actually the most isolated capital city in the world. Is that correct, Leo?
that is correct. That
All
is
right.
correct.
Typically, it's
And
only Perth people that know that.
Yep.
But I've spoken to enough first people to learn
Yep.
it. So, all right. So, consistently good outcomes, positive stories from clients and from physiotherapy peers. I do think that producing published research and being involved in education is probably an extra string to the bow if someone is to be given that title of world's best physio.
I agree. So this is where I got to know this person. So I already thought that he was very high up. Whether it's the best or not, I think I still need to make a decision. I can't just determine someone's the best by listening to other people. I need to make a
Hmm.
decision. And then when yes, I went to this person, POS. Let's say that the biggest word that comes to mind was that he was generous and he was
Mm,
giving. And by that, it covers what you've said. He, one comment that will stay in my mind forever is that he is so busy because so many people come from all over the world to want to do a PhD and research with them and also learn his
mm,
way of assessing and treating low back pain.
mm,
He's got that many people, but he said, Leo, if I'm mentoring you in your research, that means that I'm mentoring you for life.
mm.
You- And he has done that. I have finished my PhD for 10 years. He was attended, uh, yes, my wedding with my wife and also my
Okay.
farewell party from Perth.
Yeah.
And these little things tell me that he's not just, hey, I'm the best. Like, you come to me and,
Mm,
you give me what you've got. He
mm,
gives back in terms of support.
mm.
I learned so obviously there's knowledge as well. Sorry, I skipped that part, which is actually quite
You gotta know
important.
stuff.
But I think when you say the best, it's holistic. There's knowledge, there's
Mm,
communication, there's support, um, there's how they mentor other
mm,
people. It's not
mm,
just
mm,
giving,
mm,
and
mm.
and also the attitude where, like I said, I am just me personally. I'm not someone that um, likes people that's very arrogant. I'm the best. Like whatever I say is true.
Well, I have heard a
He-
rumor that this person, when attending university, I'm told, again, rumor, Chinese whispers,
yep.
telephone, it's not necessarily accurate, but the rumor goes that on the first day or the first week of attending university as a student, they vocalized that they would become the best physio in the world.
This person.
Yep.
Oh, oh, wow. Um,
And
I
I'm
did
not
ask.
saying that that's fact,
Yeah.
and I don't think there's anything wrong with it because
Yep.
I don't believe that it's arrogant. It's actually quite humble because it acknowledges, well, I'm not currently,
Okay.
but I have aspirations. I
Yep.
mean, Robin McKenzie, for example, I don't think he ever
Yep.
set out to become the most recognized physiotherapist in the world, but I believe he is such, and I believe he is such because he had an unlikely encounter with a client that then enabled him to develop a novel method of treating low back pain that was then able to be translated. I've read or skimmed through a book of Robin Mackenzie's translated in Danish that was over 8,000 kilometers from where he lived in New Zealand, and well, I mean, the Mackenzie Institute continues to teach swathes of physiotherapists, but I don't think he ever had the aspiration to become famous or to have a reputation, and that would probably be the wrong ethic, wouldn't it?
Um, interesting. I'm gonna. My sense. I don't know if he said that. Did I ask him that? I did ask him when I thought he would be the best. He said it was actually later on when he was doing post grad. He thought that he would just do his best. One big difference that I see with this best physiotherapist that I claim is that he he does not think that what the system he's created is perfect. He's
Mm,
continually striving to review, revise, and continue to get better. So
mm,
I'm using another example, if I may. I visited another practice recently, and they found out that yes, I was under this mentorship of this person, and they actually said, and I was quite proud of it. He said that wow, his early work with the patterns
mm.
that really made sense, but now it's got
Patterns for those
yep,
listening was the pattern of muscle activation.
yep,
For example, the transversus abdominis activation. That was when physiotherapists became hyper focused on the core and hyper focused on, well, this TA muscle is the solution to all our back pain problems. We later discovered that that wasn't true, but it was some of his early research and was quite useful still.
Maybe my disguise hasn't been so good, and maybe I should just be absolutely blunt. Yes, we're talking about Peter here. His PhD was on transversus abdominis. He then went back as a clinician and said, this does not help a lot of the complex patients. This helps some, like you said. Every treatment can help certain people. But he said that, right, when I see patients, transversus abdominis just doesn't help everyone, because some people he's actually since found out it's because the transversus abdominis is too stiff and it doesn't relax. So then he actually created more of the motor control pattern of
Yep.
flexion, active extension, passive extension,
Mm-hmm.
multi-directional.
Mm-hmm.
And then, and lots of people have followed that and understood it. And then he's actually developed a cognitive functional therapy. And
Mm-hmm.
he is still progressing. And one of the challenges that I also like, he hasn't always gone to the world to teach it. In fact, people usually have to beg and stab him in order for him to go to different places.
Because he loves doing what
Because
he's doing and he doesn't want to travel. Yeah.
no, he actually wants to. I don't think that's been researched enough. Rather
Mm-hmm.
than, there are lots of excited researchers. I have found this great treatment. It's half cooked, and it is true for that population. Let's present this, and there are lots of people that says, wow, this is fantastic. It's helped with it, with some of the patients. It's always some. I always see things, like I said, gray, but his way is, we don't think this has enough research. But now I think the cognitive functional therapy is still going through very rigorous research. In fact, very happy. I had a paper accepted in cognitive functional
Congratulations.
therapy with him this week. He's still continuing to research it, and he's still seeing a person as multidimensional. I think and I would say that if he said, I really don't know, strive to be the best from the beginning, I think his words would still be, I'm still striving to be the best.
Mm-hmm.
I am still striving to care about the patients. And
Mm-hmm.
he knows he's doing better, but he's not at the end point. And is it ever going to end? Well, I think he's acknowledged that, well, back pain might never be solved. It's like a cough. People have coughs. It won't be solved, but can we manage it better? And there are ways that physiotherapists can absolutely help with that. So he's still striving to be the
So it's
best.
this Japanese concept of kaizen, this continual improvement, and that we may never reach it, but that doesn't mean we should not pursue the highest
Yep.
possible standard. And I'd love to actually get your opinion on something, Theo. Leo, sorry. I don't know how I called you Theo just then. I'd like to get your opinion because you're very right in saying that the world is not black and white, and what we often use at Exercise Thought to teach our physiotherapists is that they begin with black and white. Yeah, it's either a lumbar disc that's most likely responsible for the symptoms, or it's either an overactive stiffness through certain muscle groups like the TA, as you referred to before, or maybe there's some nerve root compression that's related to some osteophyte formation. And so they learn this black and white approach. It's this diagnosis or that. And that's great for their clinical reasoning. It's great for the differential diagnosis. And it helps the physiotherapist to help relieve pain and relieve injury in a really effective way. And then the next level up is to recognize that it's a stage, it's the gray stage where, well, it might be 70% this, 30% that. It's a combination of the first level black and white. And then the third stage is this multicolored spectrum where we realize that Leo is different to every other person on the planet. And that there's actually, therefore, 8 billion types of back pain. And that's completely overwhelming when a physiotherapy student is going through school or someone's recently graduated. But that's the reality of life. And therefore, we as physiotherapists have to look across the room as a person looking at a unique person and realize what are the best words that I can share with this person today? What are the best gestures that I can offer in listening to them, in understanding their pain, understanding their circumstances? And what's the best way that I can build up their self-efficacy or their faith in their body's ability to heal itself? And look, I do believe that that faith is important, and this is why I'm bringing it up, and why I'm going to be sharing my screen in a moment, because I want your honest and brutal opinion of something that I toyed around with, which is there's a pyramid of, or rather a hierarchy of physiotherapy interventions that was published by Adam Meakins, an Australian, I believe, no, actually, I think he's an American physiotherapist. I can't remember, but yeah,
I
he
know
calls.
Adam. Yes.
You know, Adam. All right.
Yes. Yeah.
So Adam put this hierarchy together, and I've put a new base on the pyramid, and
I
I
like him.
want
He challenges everything.
he challenges everything, and I'm challenging
Yep.
the guy who challenges everything, and
Yep.
this is the pyramid. Can you see it?
Yep.
Right. So
Yep.
everything that's got a green background,
Yep.
and I suppose the top of the pyramid that was created by Adam, or published by Adam, I should
Yep.
say. And I've put in the bottom one because I believe that when the client or patient or person in pain, however we want to call it, when they are seeking a physiotherapist's help, I believe that the fundamental factor is how much faith that person has in themselves and in the therapist that's looking after them. And it's only when there's a necessary or a prerequisite level of that belief, a level of confidence, that any of the other interventions actually have a chance of working.
Um, yeah, well, my initial thought, so just for the listeners then, I haven't seen this chart where you've
No,
added this beforehand.
I've
So my
thrown you in the
initial
deep
thought,
end.
yep, straight away is that it depends. I guess the word faith to me comes straight away in my mind as religion.
Mm,
That's But as we chat and also as we look at the words that you have underneath the faith, um, it would be some of the psychosocial factors. Self-efficacy is psychosocial factors. Trust, therapeutic alliance with the therapist, that's a social factor. How people are supported and with their family, and also their beliefs about back pain.
mm,
I guess that's also faith, because beliefs about back pain. If I think that there are people out there that we've seen that I've got back pain, I'm stuffed for the rest of my life. I can't do anything
right,
anymore.
right.
If it was me, I can see the pyramid.
Mm,
Instead of faith at the bottom, I would actually see the whole PowerPoint slide, the whole white bit where you've got
mhm,
credit to Adam Meakins, the whole white bit as psychosocial factors, because they are always working in the background. A study
mm,
that I really would love to do, but I never have enough time, is I would love for, now that we have AI, is
mm,
to assess a patient and compare with another physiotherapist that assessed the patient.
mm,
And at the end, they both have to provide the same treatment in terms of advice,
mhm,
exercise, and okay, nowadays you can even use a machine to do electrotherapy. So we get the therapist to do the same.
mhm,
I have a feeling that for many patients, once again, not black and white, the person seeing the therapist, the human therapist, will do better, even though the treatment techniques are exactly the
mm.
same. I don't have research to back this up. That's just my thought. If
So are
anyone's
you telling
keen,
me, Leo, that if we had a randomized controlled trial where the physical human, warm flesh actual physiotherapist was in one group, and we had the Tesla Optimus 2 robot in the other group giving
yep,
massage, which it is capable of doing,
yep,
you reckon the first group would do better, and
yep,
you have a
yep.
suspicion because humans feel more loved and cared for by humans compared to any other species?
Therapeutic alliance,
Mm,
that has been shown. Research has shown that that helps, like being cared for, uh, a therapeutic touch, and also it's because I feel at this moment more human patients still trust
mm,
a human more than a robot. And I think I don't know if all the listeners know that now UK, the NHS system has a AI physiotherapist, and they showed some good results,
mm.
but bit biased because it is the participants are all willing AI
Yes,
enthusiasts and that works in the hospital. Um,
yes.
But also, the other thing is that what they're proposing is comparing an AI therapist with a waiting list of 9 months not seeing anyone. That's the
It's a
NHS
pretty low
system.
baseline, isn't it?
It's, yep. If you
Yeah.
compare AI with a human, I think the results will be different.
I reckon the difference is going to be exactly that, because what we're talking about is access. Either you've got to wait several months to access a physiotherapist, or you can get it immediately. And then this is where I see that the world's best physiotherapist may be a physical person. It may be an actual human being, but it might also be easy to imagine that 24 hours a day, everywhere in the world, we know 85% of the world has a smartphone and access to the internet. We know that 24-hour access is pretty important when a lot of pain is actually most intense at nighttime. And and if it doesn't cost me much money to log into, a chatbot, uh, it could be ChatGPT, could be Gemini, could be Apple Intelligence, you name it. The diagnostic accuracy is there, the immediate accessibility is there, and the efficacy of the intervention is going to be the last thing to come. And I know, I suppose I can't cite scientific evidence of that, but what I can say is that when I started practicing as a physiotherapist, most of the clients that I met that had consulted Dr. Google before consulting myself had the wrong diagnosis, or at least a diagnosis that didn't match with their symptoms. Whereas nowadays, most of the people I meet who consult Dr. Google before coming to see me have got the right diagnosis. And I think that's either a combination, it's probably a combination that the information is better and that people are getting better at accessing the information. And so I reckon that it's quite easy to imagine a future where the the correct or the most likely, most impactful intervention is recommended to people with internet based and personalized based technologies as opposed to practitioners. People will still consult physiotherapists, and I'm not aiming to do away with that. I suppose I have a heart for those who can't afford physiotherapy or people who live
Yep.
and are born through no fault of their own in countries where they don't have access to it.
Now, I might have to finish off here, and we
Of
may
course.
continue it afterwards if you want, because I do have a meeting that's related to this.
Mm,
I think my answer of best physiotherapist now is different to 5 years ago. I feel that the
mm,
best physiotherapists in the world now will be working with tools like AI, will be
mm,
working with technology. The world's best physiotherapist should not be saying, I am the best. You don't need to trust Google, ChatGPT, and things like that. There are now it's coming into health with AI, especially in radiology and things like
mm,
that. That AI is able to help screen, help prioritize patients that needs the healthcare practitioner most. And I think the best physiotherapists should know how to use them. These tools, outcome measures that
mm.
can help them do their job even better. So I might finish off with that if that's okay.
That's a perfect note to finish on, Leo.
Yep.
Thank you very much for your time.
Okay.
Thank you for what you're doing
Yep.
for the profession, and I look forward to chatting next time.
Thank you. Bye.
Bye.